If you find our content good, do subscribe to our channel. Chapter 3. Defining the review question. First, try to figure out which type of question you are trying to formulate. Therapy type like, is exercise effective in improving quality of life in persons with COPD? Or screening type like, is PSA to detect prostate cancer effective in reducing mortality? Like this, we can have different types of question as shown here. After we have finalized our type of question, we need to formulate our question on these headings: P. Participants, I. Interventions, C. Comparisons, and O. Outcomes. Defining types of participants. Let's start with an example. Say we want to do a meta-analysis on balanced salt solution in critically ill patients. How to refine our research question. First thing to note is how is the disease, or condition defined. Here it's critically ill patients. This is an ill-defined heterogeneous population. It's better to focus on a specific group like septic patients. But if most studies are on critically ill, then we have to stick to this. Say we take septic patients, we need to answer these questions. What are the most important characteristics that describe these people? Here we use the definition of Sepsis 3.0. Are there any relevant demographic factors, e.g. age, sex, ethnicity? Say we take adults. What is the setting, e.g. hospital, community, etc.? Setting here is ICU. Who should make the diagnosis? Treating physician makes the diagnosis. Are there other types of people who should be excluded from the review? Exclusion criterias. Next, we need to know the factors to consider when developing criteria for intervention. First, what are the experimental and control interventions of interest? Here the intervention is fluid resuscitation with balanced salt solution. The control group receives normal saline. Next is the most important question. Does the intervention have variations, like dosage, mode of delivery, personnel who deliver it, frequency of delivery, duration of delivery, timing of delivery? Since it's almost impossible to have every study using exactly the same criterias, this is where we face the most heterogeneity in meta-analysis. The other questions to answer are all variations to be included. For example, is there a critical dose below which the intervention may not be clinically appropriate? How will trials including only part of the intervention be handled? How will trials including the intervention of interest combined with another intervention or co-intervention be handled? Next step is defining types of outcomes. Which outcome measures are most important? Listing relevant outcomes is important. Primary outcomes are the 2 or 3 outcomes from among the main outcomes that the review would be likely to be able to address if sufficient studies are identified, in order to reach a conclusion about the effects, that is beneficial and adverse, of the intervention. Like ACT kidney injury. Secondary outcomes include the remaining main outcomes, other than primary outcomes, plus additional outcomes useful for explaining effects. Like mortality, quality of life, resolution of shock. Prevention of organ failure. Ensure that outcomes cover potential as well as actual adverse effects. Consider outcomes relevant to all potential decision-makers, including economic data. Consider the type and timing of outcome measurements. Say we are noting mortality, it's on day 28 or day 60 or day 90. We have to next define the scope of our review question. Whether as broad versus narrow. This decision is to be done, based on advantages and disadvantages of both views. A table is in our website in case you want to have more in-depth view. Link is in the description. Finally, you can change your review question at a later date. Before you do that, you must answer the following questions. What is the motivation for the refinement? Could the refinement have been influenced by results from any of the included studies? Are search strategies appropriate for the refined question, especially any that have already been undertaken? Are data collection methods appropriate to the refined question? Now that we have a question, next we will discuss analytical model.